Hello, I'm Dr. Benzeeta, Associate Professor in the Department of Clinical Immunology and Rheumatology, St. John's Medical College. I will be speaking to you about the early signs and symptoms of rheumatoid arthritis and diagnosis of RA. Rheumatoid arthritis is a chronic inflammatory disease that primarily affects the joints, and early diagnosis is the key to better outcomes and better quality of life. The signs and symptoms of RA are pain and swelling of the joints, early morning stiffness that lasts for greater than 30 minutes. Occasionally, a patient may also notice redness and warmth of the joints. You may feel fatigue, low-grade fever, and weight loss. So when do you approach a rheumatologist? If you're having any of these symptoms which last greater than 6 weeks, then it is time to consult a rheumatologist. So how is rheumatoid arthritis diagnosed? So rheumatoid arthritis is actually a clinical diagnosis, and that is why you need to see a rheumatologist for diagnosis of this disease. Joint symptoms as well as the signs that we elicit are very important for diagnosis. The joint symptoms and signs are usually symmetrical and affect both sides of the body, especially in the joints of the hands and feet. So a doctor will clinically examine you and consider this diagnosis, and several other tests may enable us to make this diagnosis. For example, rheumatoid factor and anti-CCP, which are autoantibodies that are found in the disease, ESR and CRP, which are inflammatory markers which may be elevated, and a few other tests may be done before initiation of treatment. One has to remember that occasionally rheumatoid factor and anti-CCP, these may be negative in up to 30% of the patient of rheumatoid arthritis, and the absence of these autoantibodies doesn't mean that one does not have rheumatoid arthritis, and that is why clinical expertise is important for the diagnosis.